I have been practicing anesthesia since July 14th, 1974. Old days, sometimes people give ether anesthesia and patient breathing on their own. The change sometimes is a welcome thing. Now we have become such an expert. Any change that happens during the procedure, we can recognize instantaneously, not in minutes, in seconds. And that is very, very helpful for the safety and well-being of the patient. My name is Bhaskar Rao Davuluri, Davuluri, and I am at Crouse Hospital practicing anesthesia. When we started ether anesthesia. We did not have EKG monitoring on the patients under anesthesia. And even blood pressures are not measured properly. When you go late, you would not have a ventilator. That's why we used to go very early at 6:30 in the morning so we get the ventilator. So you don't have to ventilate the patient with your hands all day.
I think a lot of things change within the anesthesia world. The medications that we have, the monitors that we have, there's always innovation trying to improve patient outcomes, patient safety.
All these changes that come, the new technology that was introduced and the monitorings, all this made a difference.
And even within the 10 years that I've been doing this, new medications have come out, which have a better safety profile for the patients that we're administering them to. And they improve their outcomes in recovery and post-op.
Your patients are concerned how the outcome will be. Am I going to make it to this procedure? We can assure them almost 100%. You will do fine. We are there every second.
The patients come first. They're nervous when they come into the hospital. This isn't a daily thing for them. So really pay attention to what they're feeling and what their needs are.
Paying attention to that patient at that time is the most important thing.
From the beginning to end, we really foster relationships with patients. They trust us to do their anesthesia. We meet them in the pre-op holding area. We talk to them, we make them feel comfortable. They're putting their lives in our hands, and we really respect that.
At Crouse, we have a lot of providers that have had tremendous longevity within the anesthesia field. Those people become great mentors for the entire department.
Things I have learned from people more experienced than me, especially here at Crouse. There's just so much. There's providers like Dr. Davuluri who have been here for 50 plus years. And I think he epitomizes what it means to really let somebody take a patient through the beginning of anesthesia all the way to the end. They're fantastic with giving you the freedom to make your own decisions, but also being there as backup and support.
I think my personal belief is the teamwork. Is one individual cannot do everything by himself.
One of the best things to learn from them is to always revert back to the hands-on care that they're accustomed to getting all the time. So use the information that we're getting through current technology, but then revert back to our own physical assessment.
Sometimes youngsters ask me, I want to go to anesthesia, and each individual has to decide why anesthesia. But I encourage them, what is that the benefit that you give to the patient by choosing this specialty for the whole life? That will help you to think, I'm doing this for the benefit of the humanity. I'm not doing not only for myself. You should be able to even encourage yourself and others as a student, as a doctor, and that is my advice to them.
My dad and my grandfather actually were both nurse anesthetists in the local area hospitals. So I saw the lifestyle it can provide and the joy that both of them took from the career.
I loved being a nurse, and I thought I'd be happy doing that for the rest of my life until I did this. And now I can never go back.